The ACD is a nonprofit patient advocacy group. We run this organization on a day-to-day basis, but this is our organization. It belongs to each and one of you. We all face challenges, and the ACD is here to represent everyone in this room. Our partners at Global Genes, they cite that 50% of rare disease patients do not have an advocacy group to represent them. So why is that important, and why are we so fortunate to have a group to give our disorders a voice? In 2012, the ACD was formed by parents with children with creatine deficiencies. At that time, CCDS did not have a home. If you were to search online for GAMT, AGAT, or CTD, you might be directed to UMDF or some published papers, but there was no place to belong to as a patient, as a parent. There were no specific resources to this disorder or these disorders. So it's really important to have an established organization who can provide a place, who can provide a voice, and who can spearhead initiatives that help change the course of these disorders through policy, through advocacy efforts, through education, and community support. So that's really what we're going to talk about today. For all of these reasons, there was a need, and we'd like to just share with you all, you've heard that our mission is to educate and advocate for CCDS and to provide support for research and education, but what does that really mean to you? And what are we really doing behind the scenes? Because there is a lot going on besides the Facebook posts or the social media chatter that you hear. So that's why we'd like to take a little bit of time to talk specifically about our education advocacy initiatives, what we're doing to spearhead and drive research, and then how we're planning on supporting our families and patients as we navigate this journey. So I'll turn it over to Kim.
Good morning. Woo, loud. Try not to be that close. Good morning. So I'm the director of advocacy, and my job for a patient advocacy group is fairly large since it's advocacy. One of our big initiatives is that we attend a lot of medical conferences. We have, I've lost count how many we've attended over the last several years. We started off with the UMDF, Whitney had mentioned, which is the United Mitochondrial Disorder Foundation. And that first meeting was really eye-opening to me. I went with Linda, and we had a really incredible opportunity to kind of get to know, I did anyway, the rare disease community, and had no idea what I was about to face. And when you hear the numbers about, 7,000 rare diseases out there and only 5% of them have a treatment, wow, we've got a long way to go. So we attend the UMDF conference. That was our first one. And then we quickly went to the ACMG, American College of Medical Genetics. That's one that we attend every single year. It's a really important meeting. That's where we meet with all the geneticists. There's thousands of people at this meeting. And I think the most interesting part about that for myself and the rest of us is that when we first went to this meeting back in 2013, I think it was, no one had ever heard of creatine deficiencies. I remember people saying, creatine deficiencies, what's that? And, we had our flyers and our brochures and our posters, and we thought, oh my gosh, these people don't even know about it. They're not testing for it. They have no idea. A few years later, we went back to that same conference, and people said, oh, yeah, creatine deficiencies. I've heard of that. Yeah. And I said, well, are you testing for it? And they're like, no, not yet. We can't get the insurance companies to pay for the mass spec, or, we don't know if we've really seen any cases. Today, we go back, 5 years later, completely different story. Oh, yeah, we're testing for it. We test everyone for it. Matter of fact, we have a new patient. And it's just a completely different story in 5 years. It's really exciting to see the progress that creatine deficiencies is making out there in the medical field. So we know that with people testing for it, of course, we're going to get new people diagnosed all the time. So ACMG is one of the big ones we attend, and also Child Neurology Society. Bruce Barshop mentioned yesterday how important it is to be targeting the neurologist. We completely agree. So we do spend our time at neurology meetings, and kind of the same thing. You know, they kind of looked at us the first time. They said, creatine deficiencies, I don't know. And now, of course, they're saying, oh, yeah, we're testing for that. So again, really some great progress. We also have attended the SDBP. This is our pediatrics. We obviously want to target our pediatric group. We go to Global Genes. I specifically really love Global Genes. That is a meeting where it's families, patient caregivers, patient advocacy groups, physicians, pharmaceutical companies. They're all coming together, and it's all in the rare disease space. This meeting is held annually in Southern California. I live there, so it's in my backyard. I'm inviting you all to come. It's a really great meeting. I walk out of there with just buckets full of information and notes thinking, oh my gosh, there's so much more work to do. I'm always really inspired, and I learn a lot. And what I learn is really how to go out and just be a better advocate for my children, for our community, for our foundation, and what we're doing. So it's a fantastic meeting. It's held in October in Irvine, California. So if anyone's interested in coming, get into contact with me. I'd love to get you signed up to go because it is terrific. NORD's another place that we advocate. NORD is the National Organization of Rare Disorders. I remember when my son was first diagnosed and someone said, oh, you should check it out. I'm sure you're probably listed in NORD. We were not. And to get, a part of the NORD library, it's taken our medical advisory board to help write some information to be a part of that library. They represent the rare disease community. They do a lot with advocacy on the legal side. They're always putting out statements if there's something about the Orphan Drug Act. They have a statement that they'll put out, and so we're a part of them. They're one of our partners. This last year, I had an opportunity to attend the SIMD, which is the Society of Inherited Metabolic Disorders. That was in San Diego, again in my backyard, which was fantastic. I had never been able to go to that, and that was a really great meeting. Gatlinburg is another conference that we attend, and that is really focused on autism. And of course, all of our kids have kind of some of those autistic features. So it was fascinating to be able to there also. And that was also in San Diego. Again, that was a fun one. DIA, which is the Drug Information Association, that was thousands and thousands of people also. And we actually were given a grant to go there. And that was amazing. So, education is the next topic I kind of want to hit on, and a lot of you have probably seen that we're doing, we have some video guys running around here. Our education efforts, a lot of it is how do we spread the word and quickly. So if you go to our website, you'll see that we've done some fundraising videos, but this video that we're doing now, that we're going to have our speakers in there, we've pulled in a few families. That's going to go out, and our target is healthcare providers. We're creating a video that's telling the story, and we're creating a video that's going to hopefully educate those who don't know about creatine deficiencies and how to test for it and what they're looking for. So if you see these video cameras running around, you'll know that that's what we're doing. We're creating these videos. And newborn screening, of course. You all heard me passionately talk about newborn screening. Of course, Michigan, New York, Utah have all been approved. California, Texas, Florida are states that are kind of those big ones that everyone asks about all the time. A lot of those states will not put newborn screening, GAMT or anything else on newborn screening unless it's recommended, as I mentioned yesterday. By the time I got to my seat yesterday after my presentation, I'd already received an email from my friends Beth and Jerry, and they said, we're going to Illinois, we're doing this. And that's just the best thing ever. So I really appreciate that support, and I know that they're going to make a big difference there. And lastly, our future efforts will be Georgia, which you hear me talk about. I was there this last fall. Minnesota, hopefully we're going to be there this fall. Illinois, as I just mentioned, and Ohio are some of our next targets. And we're looking into states that we can obviously kind of infiltrate. And that's what I got. Yeah, infiltrate. That's my word. We're going in.
Thanks, Kim.
Good morning, everyone. So my name is Laura Trutsoiu. I very recently joined the board, and I'm very, very excited. I'm a researcher by training, but not in a medical field. But I strongly believe that the questions we're facing now, we have a lot of medical questions, and we don't have answers for them, right? And this is where I feel that the role of research comes into play, right? Like it's helping us answer these really scientific questions. And our role as a parents and our role here at the association, I see us as enablers for research, right? We should push for more research to happen, and we should enable as much research as possible. And the symposium is a great example of the kind of research endeavors, right? It's really a historical event, right? Like having the researchers here, and we're really so grateful that everyone has come over, and having the parents. This is really such a spectacular meeting of the minds that it's one of the examples of what we can do as an organization to support research. And I'm going to go a little bit on my soapbox here a little bit, because I do have a call to arms, especially for the parents in the room, and it's going to echo what you've heard as messages yesterday too. To enable research, I think we need to consider what we can do, right? What do we do as parents from our homes with our kids that we're caring for daily? How can we support that? And the first thing is the patient registry. So how many of you know of the patient registry from the parents in the room? Okay, so I see most hands going up, and that's great. How many of you have filled all of the patient registry information? Okay, so it's starting to go down a little bit, perhaps. So my hope is that in the coming months, all of us will have a full information in the patient registry. So let me back up a little bit. So the patient registry is a standardized data source where we all answer the same questions, right? And we collect as much information about our kiddos as possible. Now, why is that important? Well, if you look in the room next door, you see all of these similarities, beyond the fact that all of our kids are clearly adorable, right? They have a lot of things in common, right? Like their behaviors that are very specific to creatine deficiencies. They're also very, very different. So yesterday we had a lot of research on variants, right? Like there are all these particular and specific categories that may happen in one child but not in another, whether it's seizures or whether it's autism-like features. So having that standardized information collected in one place, and it's all anonymized, and it's very private and very secure, enables researchers like everyone in this room to get a much more subtle understanding of what creatine deficiencies are. Right? So if you think of treatment options or even basic fundamental questions, you need to have that difference between what does this mutation do versus what does that mutation do. And I'm very excited because as I started, the group here was already in process of collecting, of implementing in the patient registry a way of collecting genetic information, right? So we can all work together to upload our genetic information in the patient registry, and that's going to be a huge, huge source of information, right? And the parent in me also thinks that there are roadblocks, right? Like even for the patient registry, right? Like it's painful to fill out all those forms. And we talked about this, and I think the call to arms is to think about it as, do it for 5 minutes, do it when you get the break, save it and come back later. But it's very, 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 very important, and it's probably the most useful thing that we can do at this point in terms of understanding more of the disease. And my broader call to arms is participate in research in general. And there are various ways, right? Like we send a lot of patient surveys, and these have been very useful. There are clearly various studies that are happening and are soon going to happen, more of them. And I think we're all excited about that. But as parents, we probably also have this notion of, is this something I should be doing for my kid, right? And how I like to think about it, at least, is that we as parents are always in full control. We decide what our kids should go through or shouldn't go through, and our role in the association is to facilitate that communication between the research and the parent side too, right? So if you have even a question of, is this a research study that I should consider, right? Like, talk to the researcher, ask the questions, talk to the other parents that have been through. I think it's very important to keep engaged and participate in these research studies. And always feel free to email me or email us, any of us here, and we'll happily try to bring information to the table. Thank you.
Good morning. My name is Heidi Wallace, and I'm Vice President for ACD. I've been with ACD for 3 years now, and it's flown by. I was describing to someone what I do. I kind of wear a lot of different hats, but my passion with ACD is families. So I get notifications, someone's requested to join the support group, and I get to be the first person to say, does your child have a creatine deficiency? Which one? Oh my gosh, welcome to the group. And I'm so genuinely excited, which is why this meeting is just amazing and touching. And I can't believe the people that are here. I myself, my family, this is the first time we've put our kids on a plane. It's not easy. It's not easy with behaviors, with medicines. Are they gonna think I'm a drug lord with my bags of powders? Will I make it to Austin? I don't know. This is work for all of you to be here, and I can't believe the numbers. We started planning this and tried to guess maybe 15, maybe 20 families, and I think we've got over 42. So amazing. So I'm so grateful for the sacrifice you all made. I know this wasn't easy, and I hope you're gaining a lot from being here. And I'm also grateful for the clinicians who help their patients find us. I hope that those that are here see the value of the families who have found this group and want to reach out to your other families and say, you should use some support. Some families at first, they come to the support group and you can tell they're a little reserved. And I probably freak some of you out, like, oh, where do you live? What do you do? And some people are a little more private, but it's really helpful. And we all face the same challenges. And I know when I first got a diagnosis for my daughter, nobody out there, quiet. And then I got a call from Kim. And Kim said, I've been waiting 3 years to talk to another mom who has a child like mine. So there's a lot of value in another parent who you can say, we're different disorders, but, we watch the conversations and it's, what can I expect for my child? Just tell me what I can expect. How do you potty train a child with CTD? When did your kid ever respond to their supplements with GAMT? How do you get a kid to take this stuff? This is awful. And, we parents need someone to ask, and physicians, they've never given a kid these things. They've never had to coax it down. So they can't, they can't be held responsible. We need to support each other. And that's what I'm passionate about with ACD, along with everything else. But this is what I love. I want to talk about how we all, it's a rare disease. We've all been diagnosed and gone, what? What is this? I've never heard of this. I don't think there's a person in the room that knew someone else with it and was like, oh yeah, I'll ask them. No, we're all shocked. We're all like, Guanadino, what pronounce? I don't, we're all aglaze when we're diagnosed. But thanks to our community, we don't feel so alone. We have other people. And so I really want to make everybody feel like Whitney said, this organization is for all of us. So if you have an idea or you see a gap that you think you could fill, step up, let us know. We want more people involved. We don't want to do this alone. And one of the important things that everybody can do is just be willing to say, hello, you can do this, you can make this. I live in your state or in your half of the country or whatever. So call me. I want to, you always have somebody to talk to. That's really powerful for a brand new parent who's shocked, sad, overwhelmed. All you have to do is just, check in on the Facebook group and notice who's joined, who can I be a support to. There are lots of other ways to support, which you probably get tired of hearing, but Walk for Strength. Or we had a Ride for Ben, and I don't know how many of you saw that. Amazing, though. It was young Ben who has CTD. His grandfather decided, I'm going to ride my bike from Cincinnati, Ohio, up to Cleveland, and put a sign on the side, picture of Ben, ACD logo, and take donations. And he was messaging me every day saying, I stopped at this Starbucks and talked to this person and they handed me cash. I pulled over here, I talked to this woman, she has a young child who isn't meeting the same milestones, she's gonna go get tested. Just these little efforts, and you think, I can't do anything. You can do anything. All of us have hobbies, passions, whatever. You can always talk about this, and that's how you build awareness. We feel rare, but really in a rare disease, you're a big fish in a small pond. You're the only voice, and people need to hear you. So when you come to a conference like this and you tell, one of these clinicians, I had this experience with this, they actually probably are hearing it for the first time, because we are rare, and everything you're telling them, it's really important. It's really important we share with each other, we share with the medical community, and we support each other. Out in the hallway, there's a little white mailbox, and it's got a flag on it and a slot. And there's a volunteer form
In all of your bags.
In your bags, you can fill it out. So if you
all
have an
have
idea,
one.
yeah, I used to do PR when I used to work, or whatever. A lot of the moms, you feel like you're really overwhelmed and you're not able to work a job anymore, maybe, but you got an itch. If there's something you think you want to do for us, throw it in there, and let us know. And it might be a commitment of an hour a month, or you might really figure out, this is for me, I'm passionate, and you might want to join the board. You never know. I certainly didn't know. And just by speaking up, I've become involved on the state level in Utah. I know newborn screening people. I know Dr. Longo and Pasquale and folks at the ARUP and the Newborn Screening Committee and a genetics network in my state. And I don't have a degree in this. I'm no one special, except I kind of am, like you all are, because we have these special kids and no one else can speak up but us. So I kind of weird, but I'd like all the parents to stand up, and any parent of a child with a creatine deficiency. And I'd like for us to give us all a round of applause.
Thank you. Thank you. So I don't want to leave this stage without recognizing two of our other board members. Don't roll your eyes at me, Linda Cooper. You're coming up here. So Melissa Parker is our Director of Finance. Stand up and come up here. And Linda Cooper, who is our Director of Special Initiatives.
This is the ACD board. We are working for you. So contact us anytime. Thank you.